Hello， 大家好，欢迎来到瑞视频，我是 Jennifer。3月15日，美国少数族裔媒体服务中心与洛杉矶郡新冠疫情联合信息中心举办线上座谈会，与会人士介绍了最新的新冠疫情的分布以及控制情况，对少数族裔以及弱势群体的新冠疫情所面临的挑战也进行了分析与关注。请看详细报道。
Today, we are in a fast-moving situation as LA County moves into the red tier, which allows for expanded business recovery and new guidelines for fully vaccinated people.
That's why it's so important that we have intentional discussions like this with ethnic media platforms, who are the long-term trusted source of news for communities that are disproportionately impacted by this dual pandemic, public health and economic pandemic. So I'm proud to announce that we are offering a free 30-day supply of PPE to any business in LA County with 100 or fewer employees. To sign up for time to pick up your PPE, you go to their website at ppeunite.org. I'm proud to share that the county has launched a small business stabilization loan program to range from $50,000 to $3 million and can be used for working capital, equipment purchases, inventory, or refinancing of existing loans at higher interest rates. Loan applications will be accepted until April 16th of 2021 or until a total of $20 million in loan requests have been received, whichever comes first. So please submit your application today at bizstabilization.lacda.org or email biz stabilization@lacda.org or call the following number, area code 626-586-1550. With the very recent passage of the American Rescue Plan, we will soon be able to deliver additional critical economic relief to our small businesses in the 2nd District. You have my personal commitment that we will deliver these critical resources to our businesses most in need.
Last Friday, the state announced that 2 million doses have been administered to people in the most under-resourced communities across the state. This means LA County was assigned to the red tier as of yesterday. The county is aligning with some of the state's reopening framework for the red tier with mandatory masking, distancing, and infection control practices for every business and permitted activity, and additional safety modifications required or recommended for certain sectors and activities. As certain activities are allowed to resume, we urge all residents to proceed with caution. Continue to follow these core principles and practices. Go outdoors. Outdoor activities are far safer than indoor ones. Stay masked. Consistent and correct use of masks, especially double masking, both indoors and outdoors, is very effective at preventing the spread of COVID-19. Maintain at least a 6-foot distance from others. Physical distancing from those who do not live with you also helps to keep the virus away. Avoid crowds. The fewer people you encounter and the fewer interactions you have, the smaller the chance the virus will spread. Get vaccinated when it's your turn. All federally authorized vaccines work well and will help protect you, your family, and your friends against COVID-19.
What I want you guys all to understand is that there's actually 4 types of vaccines, right? We have this first type here where it's a virus, a viral type where we actually give you a weak virus or a dead inactive virus. And some examples of these vaccines are like the flu vaccine that some of us get every year, which by the way is only 40% effective, or like the hepatitis B vaccine, that is also a live attenuated vaccine. Then there's other vaccines that are where we give you here in the orange proteins, like we we cut it up, we basically break up the virus and give it to have you respond. And this is like the HPV vaccine is an example of this. And this vaccine, these vaccines basically is we give you pieces of it. Now then there's these two other ones. There's a viral vector. I don't know if you guys remember Zika from a few years ago or Ebola. They are viral vector vaccines, and also the Johnson & Johnson is a viral vector vaccine. And then we've been talking a lot about RNA vaccines, which are the Pfizer Moderna vaccines, which have actually been around and studied for many years. So what are the three vaccines that have had EUA approval here in the United States? Well, as of last week, these are the three with Johnson & Johnson being added. We have Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna, as you can see here, are RNA vaccines. And then you have the Johnson & Johnson, which is a DNA viral vector, right? The RNA ones require 2 doses, whereas the Johnson & Johnson only really requires 1. And what I want to make sure people understand is, what are we trying to do with these vaccines, right? We're trying to prevent people from being super sick and getting hospitalized and dying from COVID. That's what the goal is. And all of these 3 vaccines are 100% effective at doing that. They all prevent serious COVID that requires hospitalization and that causes death. Right?
The story of COVID for us being on the front lines as the largest healthcare provider in South LA was really a story of disparity and inequity on steroids. First, we were unable to get PPE, masks and protective equipment for our staff. Then we initiated very rigorous screening procedures within the first week of community transition and began looking to test, but we couldn't get test swabs from our commercial lab because they were sending those test swabs. The test swabs were given to the commercial labs rather than the providers, and they were sending those test swabs to the areas that had higher insurance payouts. And so the West Side could get tested, but South LA couldn't. So what we saw on the front lines was incredible suffering, was incredible infection rates, were people who were frontline and essential workers, did not have the ability to quarantine at home, and were therefore getting sick at work, not being provided PPE by their employers, and then taking it home and infecting their families. And we're talking about factory workers, garment workers, warehouse workers, restaurant workers, grocery workers, those frontline workers who live primarily in South Los Angeles. Many people lost their jobs. If they tested positive, they weren't allowed back. They lost their homes. So we saw a tremendous amount of suffering. And I want to emphasize this point about vaccine hesitancy. We're not seeing that. What we're seeing on the front line is patients who need access to vaccine. All of the 80,000 vaccines that we've given, 95% have been given to the African-American and Latinx communities. I also think that it's our job as community providers to really target the populations we want to reach. So the websites that the state has set up are very, very cumbersome and very difficult for communities, our communities, to access.
All of those things are hopeful. And so we just have to continue to be vigilant, continue to be smart in terms of how we protect ourselves, our families, and our communities. And I feel hopeful, and I'm proud to work collaboratively with LA County to make sure that county residents get what they need to be safe.
以上是美国新闻速递记者庞可阳来自洛杉矶的报道。